there who, again, survived the acidic Holocaust.
So I think that we should just chat about some of the topics that I think people want to know about. And I think first, just in case we have any new people watching this, we should like introduce ourselves and who we are.
Cool.
So you go first.
I'm Sandy. I'm a physical therapist. I own Pivotal Connections Physical Therapy. We have 2 locations, East Coast, West Coast. East Coast is still happily operating in the closet of CrossFit packs. And up until November, I was in Humboldt CrossFit, and now I am on my own, operating my own little clinic here in Humboldt County, California.
Nice.
Yeah.
So I am Christy Campbell, and I am a nutrition coach and a CrossFit coach and weightlifting coach. And I'm a mom of 2, and I live in California, Maryland right now, but I will soon be moving. Yes, I will soon be moving to Washington State in June. So we're a military family, and so we're moving. And I have had 10 knee surgeries. So I feel like that's going to be relevant to this conversation.
Yeah.
And so I have a little bit of background with joint issues, which is kind of what we're going to talk about today, is joint stuff.
Yeah.
So I have a couple questions that I think that most people would want to know the answers to, but then we'll just kind of take it in whatever direction.
Okay.
So one of the things that I think is helpful when we're talking about joint stuff is understanding the difference between like an injury, like an incident that something happens versus like a chronic injury. So can you just talk about the difference between the two?
Yeah. I mean, on the most like simplistic form, or the most simplistic way to think about it is that there are different things in your body that respond to injury, and then there's like, think of them as like a little team. There's a little team of things that if you cut your hand, or if you get a bruise, or if you tear a muscle, that little team is going to respond, and they're going to try to address the situation. They're going to they're going to address the inflammation that has been caused by that injury. But then they're going to also have a team that is going to try to repair it and fix it and perform some triage. So that's like an injury kind of inflammation and inflammatory response. There's a different kind of inflammation that is more present with like chronic things. So even if
describe like an example of like an acute injury versus like a chronic thing.
Yeah. So an arthritic type of joint would be more of a chronic inflammation, where that joint is irritated from either abnormal use or improper use. Whereas, am I answering your question?
Yeah, no, that's what I mean. I think people what are the like examples of the difference between the two? Like a sprained ankle versus like a shoulder.
Yeah, so an acute injury, like you say, you cut your hand, you tear a muscle, you get a bruise, that is an acute inflammation where it's not gonna probably linger for too long. It can, that's also why we're having this conversation. But then there's a chronic, like interstitial, inner joint, abnormal presence of inflammation chronically over a longer period of time inside a joint.
Mm-hmm.
So that's kind of the best way to think about inflammation. So short term and then long term.
So I think because for anybody who's ever had an injury, you immediately think like, oh, I have to get the symptoms to go away. So like if you sprain your ankle, and then you get swelling in your ankle, like tell me what's happening with my body, like what's going on.
Yeah, so well, and I also want to speak to the ice thing, because there's some relatively interesting research that has come out in the last couple of years where in the fitness arena, we've always been taught to rest, ice, compression, and elevation. So they're now finding that ice is not actually the best thing. So let me speak to this. So when you get that injury, you that little team of stuff arrives at so if you sprain your ankle, is that the example you gave?
Yeah.
Okay, you sprain your ankle, there's a huge increase in blood flow because a lot of this little team travels to that site.
So you would feel that like with heat, maybe like your ankle might feel hot?
Might feel hot, yes. And depending on how bad it is, it actually won't feel terrible at first because your body has sent other chemicals to make it not hurt as bad. That's why sometimes people can get really bad injuries and keep playing. And then for that ankle example, and then they take off their shoe or their boot, and then they have this huge ankle, and then it hurts. But anyway, so you send this little team arrives, and so yeah, the heat is an increase in blood flow because your body recognizes that something significant has gone on and it wants to address it. But that blood flow is actually good, and a good amount of it will bring the good stuff to that place, give it to that injury, and bring the bad stuff away.
That makes sense. And so then do you think that too, like when you've had a sprain or like some kind of injury that happens, your body gets pain signals because you need to let that joint or area rest and you're not supposed to use it, right? Like your body needs some time to heal.
Yeah. Yes. On certain levels. I mean, if it's a significant disruption to soft tissue, torn ligaments, torn tendons, yes, then there needs to be you need to let the good inflammation, we'll call it good inflammation, maybe bad inflammation, let the good inflammation do its job and take care of that. Yeah.
No, that makes sense. And I was mostly thinking about pain. Like when people experience pain, like when they have an injury like that, like that's your body telling you like, hey, like don't do that right now. Like that's pain.
Yeah. And I'm trying to not complicate the situation, but yeah, there's different pain signals in your body, and that acute pain you definitely need to be aware of and be responding to. But there is something to be said for a little bit of movement and a little bit of activity and letting muscles fire that are not completely disrupted. That is also something that we're finding should happen sooner, more often than, just rest, ice, compression, elevation. Like that's not always the best option. A little bit of movement goes a long way.
So then, like, if you think about a different type of joint issue that people have, like say they don't have an incident, nothing happened, they didn't fall, there wasn't a thing, but they say like, my shoulder hurts, I have this spot that hurts, and it pretty much hurts more or less all the time when I'm doing certain things, and it aches sometimes, and it's been going on for weeks. Like that is a different type of issue.
Yeah, absolutely. And as long as there's not an incident, like an actual occurrence of an injury, usually that's a repetitious injury. I mean, I'm also thinking more along the lines of CrossFitters and athletes or people that do repetitious movements. If we're talking about a shoulder, if I'm trying to kind of play it back to the inflammation, but there's the joint. I don't know how in depth you want me to go, but because the shoulder shoulder's a ball and socket joint that has a capsule around it. And so inside of that capsule, there's fluid, and there's good fluid. And if that ball moves abnormally in the socket for some reason, be it muscle imbalance, where that ball is going to move abnormally, it's going to rub abnormally and cause a bad type of inflammation. And that's one of those, that can be one of those things where you're like, something is just not right, and it doesn't necessarily have to be this huge injury. It can develop into a huge injury. But that type of inflammation and pain is to cause awareness that there's a breakdown in the chain somewhere, and that should be addressed sooner than later.
So how long is a joint pain? Like if I had a joint that was kind of funny for 2 weeks and then it's fine, I'm good to go. But how long should I go before I'm like, something is definitely not right here?
Well, if you're you have that discomfort and you cannot make it better on your own or have something that makes it better, and you see a continual decrease in that discomfort, then you're probably on the right track. But if you have that discomfort and you really can't make it go away, and it's not getting any better, that's when it should be addressed. Because chronic, or not necessarily chronic is multiple weeks and months, but if you're doing things like CrossFit or overhead movements, or even sometimes just sleeping and something is irritating you, that inflammation, when it stays there and it's not addressed, then you start to cause cellular damage and issues and to that tissue, and then you have an injury.
And I think like whether it's CrossFit or just like regular life or weightlifting or just playing like fun sports on the weekend, I think a lot of people accept that like a certain amount of like joint pain is normal. Do you think that like is like a bad thing that we've kind of like culturally decided like we can be hurt all the time?
Yeah, absolutely. You should be able to, as long as it's not this whole weekend warrior thing, we'll get away from that. But if you are regularly doing CrossFit should not hurt you. And I guess, I don't know if I should keep going back to CrossFit.
No, it's fine. You can use any example.
CrossFit, you will occur when you push your limits and when you lift heavier things. There is a break. You're kind of these little micro tear philosophy of building. That's how you build muscle. That's how you get stronger. But there's a distinct difference between muscle soreness and discomfort from getting stronger, and then there is a pain that occurs with abnormal movement and just dysfunction. And to me, those feel different. So you perform lunges, and lunges aren't necessarily something you do very often. Your quads and your glutes might hurt because you did that, and it might feel tender, but that should go away on the extreme in 3 days. If that does not go away, then something else has occurred.
Or you're moving poorly, or you're doing something that's causing pain. There's
a breakdown in the system somewhere, and you should not do that movement again until you get that addressed, whether you think you know what it is and you can stretch it out or roll it out or move it out. But yeah.
So then there's a third type of like joint pain that I want to talk about. And then I kind of want to chat about how food and lifestyle stuff impacts all three of these. So we talked about like an injury, like an acute injury. We've talked about sort of like a movement problem or like an overuse type of pain where you're doing something and you're feeling pain, even if that doing something is sleep. And then I think, at least in my mind, there's a third kind, which is maybe like somebody who has had a surgery years ago or an old injury, and they're still having some sort of pain in that joint. Or maybe they feel like things have never been right, or they have soreness or arthritis.
Right.
And so just talk about that for a minute.
Sure. So, sorry, Carrie had just come in. Do you want to say hi to the world here? Carrie just came in, so I might have you repeat the question.
She disappeared.
Say hi to the world.
Hi.
Doing a little recording. This is Christy.
Hi, Christy.
So you're officially.
Carrie, about you.
Carrie keeps my world going round.
Yay.
Sorry.
I'll try not to distract you.
You're okay. Okay, so we have this third type of inflammation.
Like, talk to me about arthritis pain. Like, what am I feeling when my knee hurts?
Yeah, so arthritis is a pesky little bugger. So joint surfaces should be smooth in theory. They should be smooth and move against each other well. That fluid, or there's a normal fluid and then there's inflammation fluid. So when you have inflammation fluid that has built up and causes a disturbance to how those joints move against each other, the surface of that joint becomes abnormal, irregular, and less smooth. So those surfaces will not feel great when they rub against each other. And that is kind of the very basic, very simplistic description of arthritis. So arthritis occurs between joint surfaces, between bones, and they just
rubbing.
They're either touching, but they don't even necessarily have to touch. That what should be a smooth surface becomes less smooth, and that the fluid that is moving between those joints becomes viscous, and so they just don't move, they don't slide well, and when something doesn't move and slide well, that's what causes pain and discomfort.
Okay.
So usually heat is the best for arthritic pain, because it increases it decreases the viscosity of that fluid. So even if that joint surface is bumpy, it's going to move better. That's why exercise is, when your body temperature increases and your body is warmed up, those joints and fluids move much better against each other. That's why exercise is really, really prescribed for people with arthritis.
Okay. Yeah, that's great. I mean, I think about these types of injuries a lot because with my nutrition clients, we talk about like lifestyle factors like sleep and quality of food, and also like getting the right amount of food and avoiding things that cause inflammation. And I think that in each of these three categories, there are things that people can do that are in their control to help with their symptoms. Like, so for example, like instead of relying on just taking like a anti-inflammatory medication, or like just saying, I can't do anything, I'm just going to go see my doctor. I think that there's some proactive steps that people can take along the way to improve their outcome, whether it's like an incident, or whether it's like a thing that's happening right now, or whether it's an old injury. I've seen over and over again, and especially for myself, that there's a couple things that are absolutely within my control that make it better. And so I wanted to talk about those, and I'll list them, and then you can give me like your experience and if there's any examples that you know of. But for one, I think sleep is a huge one, because if you've got any type of injury and you don't sleep, like I think that's when your body's going to do the majority of its repair work, is when it's resting. And so if you have, if you're not sleeping enough, and sleeping not just unconscious, so unconscious is not the same thing as asleep. And so if you are asleep from a bottle of wine, that's not the same as like falling asleep, not in that same kind. Also, if you have to take a medication for sleep, I've read that that's not the same as falling asleep on your own. Your body is not resting the same. And so I think that sleep is one where if you've got some joint issue going on, going to bed earlier, getting a longer amount of sleep, more restful sleep, avoiding alcohol before bed, those kind of things can really help.
Yeah, you have to set yourself up for success.
Yeah.
And if you're hurting and you're in pain, sleep and food are the foundation. That's where you should always start.
Always start. And so then, like, if I think about food too, at least for myself, I've done a couple Whole30s in the past, and in the process of doing the Whole30, I learned that there were certain types of food that I didn't do well with. for me personally, those are dairy and like grains. Both cause issues with my skin, with my stomach, and just overall, like through the Whole30, I learned that I just don't do well with those. I even get like eczema all over my skin from grains. And so because I've had 10 knee surgeries, I have also observed that because I have sort of like that ongoing arthritis pain that's never probably going to get better, it actually varies with the type of food that I'm eating. So if I am eating a lot of dairy products or a lot of alcohol or something that makes my body feel fluffy, and I think like everybody's kind of felt that before, like they drank wine and the next day they're like, oh, I feel really fluffy, or like I just had an ice cream sundae and my stomach feels bloated and uncomfortable. For me, I immediately can sense that in my knee. Like it is less good. It hurts a little bit more the days that follow. And I almost have to wait till my system clears that before I notice, okay, now my joint is on the like better end of its range. Do you see that for other people?
Yeah. And when you have an injury, so inflammation is fluid, and fluid and water will follow the path of least resistance. And so those, like your knee, and other people that have joint injuries and issues, that is where those are the weak links. So that's where the path of least resistance occurs. And so that's where it's going to fester, and so that's why you feel that discomfort in your knee right away, because that inflammation is going to follow the path of least resistance.
And I wonder too, if I didn't eat the way that I do, if I just ate whatever was available all the time, I would probably think that my knee just hurt a lot all the time. I wouldn't even realize that by removing some of the inflammatory foods, I could actually feel better. Like I can't solve my arthritis. My knee's never going to be brand new, but there is a significant difference in how it feels depending on like how well I'm eating.
Yeah. No,
so you could be living in pain and it could be less if you tried a little bit different.
Yeah, you could probably chalk that up to I've had 10 knee surgeries. And that point and that pain can just continue, and you just go about your business and you just think that you have to deal with it instead of, diet alteration and that sort of thing to decrease that inflammation in your body can easily make those normal aches and pains go away.
And if I had to list, just for people that are listening, like if I had to list like a top inflammatory foods list, dairy would absolutely be at the top of that list for a lot of people. Sorry, Wisconsin girl. I also would list that gluten and grains can be problematic for a lot of people. And then alcohol can be a huge inflammation type of thing for a lot of people. And then certain types of refined sugar, I think people like really have a response to that in terms of inflammation and their body not feeling as good. But if you have one of these injuries, if you've got a joint thing going on, no matter what stage it is, it's really important to not have those in your diet.
Absolutely.
So that was just like one of the lifestyles. So like we talked about sleep, we talked about inflammatory food, but I also think that sometimes a really common mistake that people make is if they have an injury or if they've had a surgery or if they've had something going on, they immediately slash their calories and think that their body doesn't deserve to eat enough food because they're not doing anything. And I think that that might even slow the recovery process. Have you ever observed that?
I know that diet is kind of considered out of the scope of practice for therapists. So I don't know that I have enough data to speak to that. But what I can say is that I get to see athletes at all different times of the year, and that more often than not, people do nutrition challenges at the beginning of the year. It's like the New Year's resolution thing. And that I have had clients that were struggling with sort of chronic inflammation, pain issues, and I pulled everything out of my hat to try to figure out what it was, and how to fix it. And that a few of them, all their discomforts went away when they went through Whole30s. When they went through, I can come up with about three to four just in the last couple of months that I haven't had to treat anymore, because they figured out what it was in their diet that was causing problems. So chronic shoulder pains that were waking people up over and over and over at night, that was not nerve, was not musculoskeletal, it was all diet related. So,
and the way that I read it in the Whole30 book is, and I don't know if this is like medically correct, I'm certainly not a doctor, but that your body only has a certain amount of bandwidth to deal with problems. I think we've all felt that before. Like if you are fighting a cold or something and everything else, all your ducks are in a row, your sleep's good, your stress is good, all of that, your body fights it off really quickly and easily. Meanwhile, like if you have a cold and you're not sleeping well, you've got stress going, like especially in the holidays, this is when most people feel that like everything is going on and on and on. Well, then that cold that could be 3 days lasts 8 days. You just know that your body doesn't have the bandwidth. And I think when I read that Whole30 book and it was talking about inflammatory foods, it was saying like if your body has to deal with constantly dealing with food that your body isn't processing well because it doesn't tolerate it well, then it doesn't have the bandwidth to work on other things like heal an injury. And I don't know if that's medically correct, but it did make sense to me that like you're not going to set yourself up for success for healing a joint issue if you have a lot of inflammatory foods in your diet.
Yeah, I mean, you already have a pre-established arsenal of fighters in your body, and your body can produce more, but that also takes energy for your body to have to do. So if it has to, it sends out that little arsenal that's going to fight whatever issues are going on in your body, and you just keep requiring more and more and more of that team, that little arsenal, that requires more energy from your body. So you're just going to be more and more depleted. So, I mean, there is your body does adapt and it can fight that, but there is definitely something to that whole bandwidth analogy. Yeah.
And I think like in terms of what your body can handle, being in a calorie deficit is its own type of stress. And so like dieting deliberately in a calorie deficit isn't necessarily a bad thing, but you want to have a lot of your other ducks in a row. Like you don't want to be, not sleeping and having a lot of stress and exercising 7 days a week and also fighting it, recovering from a joint thing or whatever. I think that like understanding the right time of year to be in a calorie deficit for yourself, depending on what your goals are, is really important because, just because you're working through an injury doesn't mean it's the perfect time to diet. I think like you have to kind of like assess, is that a good idea? Because I remember like, at least I can speak from my own experience, doing like a template that I had on the internet after I had one of my knee surgeries, and I was in a extreme deficit. And I think I probably slowed down my recovery from that surgery because of being also in a deficit. I was making my body work extra hard.
Absolutely. That makes perfect sense. Yeah.
And the last lifestyle thing that I think we can think about in terms of our, in terms of like joint issues is stress. And nobody ever wants to talk about this one. Yeah. But I think like if you aren't managing your stress, then you also can potentially prolong an injury and you can also make it worse. Yeah. I know, again, that's like more nebulous, less science for you, but like, can you talk about stress?
Absolutely. I think that the time of year that people are the most stressed is around the holidays, and you kind of mentioned that. And that stress, that's oftentimes where I see some of I see a lot of injury around the holidays because people are stressed, and stress releases a hormone, a chemical in your body, and that can disrupt your body's ability to function correctly. It can affect the way that muscles function, and it can disrupt the way that normal way that they're supposed to. And then when you do that, that can cause injury. So something that you normally do, if you've got a ton of cortisol released into your body, it can definitely cause pain and problems, both at your muscles, tendons. So
no, and just managing your stress and this is again something that I talk about all the time with my nutrition clients, but doing things to make you feel less stressed when you're stressed are really good, right? So like if you feel really stressed, you can go for a walk, or if you feel really stressed, you can like take an Epsom salt bath. But those are not the same as addressing the source of your stress. So if you have things that are sources of chronic stress, ultimately you have to attack those if you really want to work on that particular aspect of your lifestyle. So for example, like if you are stretched to the limit because you're overcommitted in 1,000 ways, a walk isn't going to solve that problem. You're just going to feel better for a few minutes and then it'll all come right back. And so like, what can you eliminate from your obligations to make your day-to-day more doable? Maybe working on like different parts of your like communication skills and all of that kind of thing can make stress go down. Maybe limiting interactions with people or places that cause you stress can be like really important. And I can't understate it enough. Nobody ever wants to tackle that part of the lifestyle because it's really hard. But ultimately, like if your goals are to make a joint feel better or just overall like get stronger, lose weight, all that good stuff, like if you're not addressing the stress part, then you're missing like a really big part of the thing that you can control, the part that you can help.
And the other thing that I see is when people are super stressed, that's when they go hard at the gym, or that, you know, they want to release all that tension and that energy and try to make themselves feel better. So they'll go really, really hard at the gym, and that's when injury occurs also.
Yeah. Well, I feel like we covered a lot of stuff, and so maybe that should be where we wrap up for today, but we'll do like more of these conversations on different topics. I mean, just to kind of summarize, we talked about like 3 types of like joint issues or pain, like from a immediate like acute injury to like a overuse or chronic thing that you're feeling, or maybe just a dysfunction in your movement or posture that's like making your joints hurt, and then maybe like dealing with an old injury or arthritis. And then we talked about like the different lifestyle or diet things you can do to at least set your body up for success, so it can handle that and you can minimize your symptoms. One last thing, because this is really important to me and I wanted to know your opinion on it. If someone has been taking an anti-inflammatory, like an NSAID, right? A non-steroidal anti-inflammatory.
Yeah.
Can you talk about the downsides? Are you able to talk about the downsides of overuse of that kind of?
That's in my scope.
Okay.
So, and mainly because there's a lot of research behind it, and again, research that's coming out in the last couple of years, that when you, well, 2 things. When you take an NSAID, anti-inflammatory, for a long period of time, that kind of depletes your body to address what's going on. Meaning, I've kind of talked about this little team that your body sends to an area. What that anti-inflammatory does is it slows that team down, and it stops that team from arriving on the scene of the injury to take care of it. And so because sometimes you do have to go through discomfort for that team to do its job. So our thought was, if it doesn't hurt, by stopping the inflammation, that you were healing. But that's not the case. So your body needs to send that team. You need some of that inflammation. So if you over a long period of time are shutting that down, it's gonna stop your body from addressing what's actually going on. And then this is less in my scope of practice, but oftentimes a long-term use of those things can tear up your stomach and your liver in some bad ways. And I think I'll stop there at my scope of practice. But
Sure.
But yeah, for a long period of time, everybody take some ibuprofen, take some Advil, take all of those things, and that we've been seeing through research that actually slows down your healing process over the long term.
So there's like probably appropriate application for taking a Motrin or an ibuprofen or something, like but using them long term might not be ideal.
Exactly.
And so definitely would encourage everybody to try to find different ways to handle their joint pain and their issues rather than that. And trying some of the things that we talked about today, I think, are a good place to start.
Yeah. Movement and diet are definitely a place to start with joint problems.
Yeah. Well, yay. This was really fun. And
yeah.
I like all your pictures behind your head.
Okay. I'm so PT.
I should have pictures behind my head.
You look very studious though. It's got the
I've got books and stuff back there and kids stuff. But well, until next time then. Thank you so much. All right. Bye, Sandy.